Now I want to bring in Dr. Lois Ombajo, the head of Infectious Diseases Unit at the Kenyatta National Hospital and also a lecturer at the University of Nairobi. Dr. thank you for speaking with us again right here on Newsnight. You've seen, or you've probably heard a bit about that report. You know that the FDA has given emergency approval to the Trump administration's plan to distribute millions of doses of anti-malarial drugs to hospitals across the country. This is a significant development, Dr. Sam would say, especially because of the global standing of the FDA. What is your take on this?
Thank you very much for having me. So maybe just to recap on what you've already said, that the FDA today has approved the use of these drugs that we haven't used for a long time here, such as chloroquine and hydroxychloroquine, which is a drug we use for conditions such as lupus. And this is really based on some preliminary data or early data that has come out from some studies, especially in France. And what these studies have shown is that when they used hydroxychloroquine in combination with an antibiotic for treatment of patients who had COVID, then they noticed that the patients got better a little sooner, did not progress as much as expected, but they also did not shed virus as much as was expected. So this seems to be a step. Usually before a drug is recommended as approved for treatment of whatever condition, we usually rely on data from what we call clinical trials.
Okay.
And in these clinical trials, what is done is that you give a group of patients the drug and another group of patients are not given the drug. And you observe to see what differences might be there in these groups of patients. As you can imagine, this usually takes a long time. So for this one, because it's an emergency situation, everyone is sort of scrambling to find something that may work. And here we've seen a number of researchers and clinicians looking for whatever may work. So in this case, this drug has been shown to have some effect in, one, reducing shedding and improving outcomes. So that may be some of the factors that influenced approval. Yes.
Is that something that the Ministry of Health here should be considering? Is the question on the minds of many Kenyans tonight?
So this is something that as clinicians who are really working on the front line and helping to develop some of the guidelines around treatment, we have actually given it some thought.
Okay.
And we've reviewed a lot of the data and literature that's coming in from other countries. And some of us are soon going to be involved in some of these clinical trials as well. And in our initial thoughts around this, one, there wasn't very much evidence for it. Now we seem to have a little more data. But even then, initially we had suggested that this is probably something that could be considered in patients who have very severe disease or who are rapidly deteriorating. And the reason why it might be considered in this group of patients is that, one, someone who has very severe disease, there's a risk of death. And the other thing is that people with very severe disease tend to shed virus for a long time, which means they remain infectious for a long time. Because of the lack of very much evidence around it, we have not really recommended it for people who have mild disease. But as you can imagine with everything COVID, we are learning and there's a lot of rapid change happening. So we stay on the lookout to see what new developments may be there from other parts of the world and from our own context. And we can change these guidelines as time goes on.
So it sounds like you're saying yes, no, you're sort of in between in terms of whether the Ministry of Health should be considering this. Earlier on, we actually spoke to Dr. Moth, the acting DG at the Ministry of Health, who said that there is no immediate plan to use chloroquine to manage COVID-19. Is there a possibility in the future that that could change and under what circumstances?
So maybe just to say something I'd said earlier, for people with mild disease, we wouldn't be considering it at this point.
Okay.
But where we have severe disease or rapid deterioration, then I think this is something we can consider. Of course, as more data becomes available, as we begin to learn from other people's experiences, these are things that can change. So for now, I would personally say if someone, most of the people have mild disease, even the patients we have seen are doing well and are not unstable, they're fairly stable. So we may not need to give them this treatment at this point.
So tell me,
if someone was very sick or deteriorating very rapidly, then we could consider it.
You could consider. So then tell me this briefly. We have at least 59 people who have tested positive for COVID-19 in this country. What sort of treatment are they on right now? Are you able to give a brief summary?
So maybe not for all the patients, because I have not seen all these patients. Most of the patients that we have seen have had very mild symptoms, and usually the treatment is more of symptomatic relief. So if there's some fever, we'll give them something like Panadol or paracetamol for that fever. If they have a running nose or a blocked nose, then we can give them what we call an antihistamine, which sort of reduces that congestion around the airways. So that's what most of them have been on. There have been a few patients who've been more severely ill.
Yes. Sorry, go ahead, finish that. There are a few patients who've been severely ill.
Who've been more severely ill.
Yes.
The other day you had the announcement of one patient who had died. And I think in some of those circumstances where you're faced with a very sick patient, you could consider using some of these new therapies.
What would you say to Kenyans tonight who are pondering, thinking about going to get a chloroquine or hydrochloroquine? I hope I've said that correctly, over the counter?
Yes, okay. So one of the things we have to realize is that a drug like hydroxychloroquine is used for other disease conditions. So for example, in this country, we use it for treating patients who have lupus. You know, lupus is a fairly life-threatening condition, which if not well managed can lead to a lot of organ failure. So these are patients who depend on these drugs. If we go out and start buying and hoarding them, then we deny life-saving therapy to other patients. So I think we need to be responsible and not rush and hoard drugs that are not useful to us immediately, while denying patients who need these drugs access to the same. So if anyone is thinking of going to buy it, don't. You know, don't go and buy it. It may not be useful to you. As we've said, the data is still evolving, and usually in such emergency situations, sometimes one study shows something, then soon another study shows something different. So until we have better data, please do not go out and hoard some of these drugs. And I think even for pharmacies that sell them, at this point, they should only sell them to someone who has a prescription from a doctor, not anyone who just walks in and wants to buy.
And I can imagine they have side effects if used wrongly.
Maybe they are... Yes, that's an important thing to raise. And again, we have to watch out for side effects. Drugs like chloroquine are known to have side effects. So it's important that we don't take drugs for which we do not need.
Thank you so much. Dr. Lois Ombajo, Head of Infectious Diseases Unit at Kenyatta National Hospital and also a lecturer at the University of Nairobi.